Welcome to Penrose Learning, where we make understanding easy.
You start by confirming the correct dose right now. Read the updated label and check your baby's age. Once confirmed, wash your hands and prepare the clean dropper. Do not estimate by eye. Place the dropper into the mouth alongside the cheek while holding the infant upright to reduce choking risk. Make sure to calm the baby before administering so they swallow smoothly, and burp them gently immediately after giving the drops to release trapped air. Now you will administer the dose deliberately. Draw the exact amount into the dropper and tap out any air bubbles. Accuracy matters. Once done, position the dropper against the inner cheek and squeeze slowly so the liquid flows in steadily instead of a quick spray. You want the baby to swallow, so avoid forcing. Allow pauses if needed. Keep the infant seated upright for 10 to 15 minutes after dosing to help the medicine settle and to prevent spitting up. Finish by documenting the time and amount you gave and monitoring effects. You'll know progress within a short window. If the baby needs another dose, make sure you do not exceed the label frequency and wait the recommended interval. If symptoms persist beyond about 24 hours or worsen, contact your pediatrician for guidance. Troubleshooting. If the infant chokes, develops a rash, has difficulty breathing, or you suspect an overdose, stop immediately and seek emergency.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.